welcome back to my channel. My name is Arza and today's vlog is about my 31st week pregnancy update, and that includes my recent prenatal visit and my recent blood test result. So today or this week my baby girl is about a size of a head of a romaine lettuce. That's about 17.5 inches long and 3.5 pounds in weight. Though they could grow more for about 3 to 5 pounds for the coming week before their birthday, especially if you have diabetes and your blood sugar is not well controlled, the baby could grow much bigger. So it's really important for us to make sure we watch our diet and our blood sugar is well controlled. And based on the app that I'm using, babies on this week are beginning their final preparations for delivery, as their senses are now intact and they continue to pile on that baby fat. And their immune system is nearly ready to fight and prevent illnesses on their own. They just need some time outside of the womb for it to be fully developed. Their brain and nerves continue to develop under their head, which is still very soft because the bones that make up the skull are not yet fused together, so that they continue to pass as easily as possible through the birth canal. These soft spots are called fontanelles. These fontanelles won't fuse together until they're about 2 years old or a little younger. They are now growing more flexible as their neck and joints every day, so they continue to be making a lot of movements down there in the next 2 months. So they're making a lot of developments this week, and as we get further along with our pregnancy, I'm so excited. It's only 8 weeks and I'm gonna finally see her. I'm just hoping that everything will go well, that everything will be all right. And I'm just trying to think positive about everything. I'm kind of nervous, but I'm very excited. I guess everyone is like this during pregnancy, because sometimes I can't help but to be paranoid with a lot of things. But I'm just praying and I'm just thinking that everything is going to be all right. And for this week's signs and symptoms, difficulty breathing is normal because our baby's getting bigger and they're really crowding our lungs. And I definitely feel that. Maybe you can notice sometimes when I'm talking that I'm like running out of breath. But yeah, I definitely feel the difficulty breathing or shortness of breath sometimes. But if your difficulty breathing is persistent and it follows with chest pain, you should call your doctor immediately to be checked to make sure you and your baby are fine. And also, if your body is overproductive, you may have a yellow discharge on your breast called colostrum. So you may want to invest with breast pads to soak it all up. And for some, you may also experience Braxton Hicks more often, but for me, I'm not really having any contractions yet. I haven't felt that so far. But you guys, just remember that if you're having a contraction more than 4 times in 1 hour, you should be cautious because it might be a sign of premature labor. So you have to call your doctor right away. Other indicators of early labor are bloodier vaginal discharge, lower back pain, and increased pressure in your pelvis. Do you guys experiencing Braxton Hicks already? Because for me, not yet. And I want to hear all your experiences about it. So for me, this week's signs and symptoms, aside from difficulty breathing, is that I'm getting heartburns more often now. But during the day, it's just mild, but it's getting worse at night when I'm laying flat in bed. So I make sure that my head is elevated and that as much as possible, I sleep on my left side. And I think it really helps a lot. And also, I get dizzy more often this week. And my recent lab test results showed that I have a mild anemia. And my doctor said that it could be the reason why I'm having those episodes of dizziness. Oh, and about my gestational diabetes update. So this past few days, like 3 days ago, 5 consecutive nights during dinner, I'm having a high blood sugar. It's like at 150s or more. So as I've mentioned in my previous vlog, I am taking insulin, 12 units of insulin during dinner or before dinner to help with my blood sugar. But then for that 5 consecutive nights or recently, it's really not working for me anymore. And on the sixth day, I decided to have chicken breast, a boiled chicken breast, and boiled mixed vegetables, and also administered my insulin at the same time. And then, not even an hour, I felt dizzy and so weak, and so I checked my sugar, and it was low. It was 56. Actually, I knew that my blood sugar may drop because chicken breast is protein and mixed vegetables has only few carbs on it, so it's not really gonna spike my sugar. But I just want to test it to see how my body will respond to it. And so now I know that if I do that again, my blood sugar will drop very low. So I'm not gonna do it again. Gladly, I am able to treat my low blood sugar right away and to stabilize it. And also, in my recent prenatal visit, I have my Tdap vaccine, which stands for tetanus, diphtheria, and pertussis vaccine. I believe that it's really important to get it because it helps us and our baby to build immunity to these kinds of diseases. So tetanus or lockjaw, it's actually a very rare disease here in the United States today. It causes painful muscle tightening and stiffness, usually all over the body. It can lead to tightening of muscles in the head and neck so you can't open your mouth, swallow, or sometimes even breathe. Tetanus kills about 1 out of 10 people who are infected even after receiving the best medical care. And then diphtheria, it can cause a thick coating to form in the back of the throat, and it can lead to breathing problems, heart failure, paralysis, and even death. And also pertussis, it's a whooping cough. It causes severe spells, which can cause difficulty breathing, vomiting, and disturbed sleep. It can also lead to weight loss, incontinence, and rib fractures. These diseases are caused by bacteria. Diphtheria and pertussis are spread from person to person through secretion from coughing or sneezing. Tetanus enter the body through cuts, scratches, or wounds. So I hope you guys will get yours too. I know there are people who are against vaccines, and I do respect that. But for me, I really think that getting vaccine is very important, and that's just my personal opinion about it. And also here in the United States, since flu season is coming, I'm gonna have my flu shot, and again that is to help me and my baby to build immunity to flu. Especially flu is very contagious, and here in the United States, it's gonna start, the flu season is going to start in September until May of next year. But I believe they're gonna start giving vaccine end of August. Hope you guys will get yours too, so you and your baby are protected to these kinds of diseases. And next week, I'm going to start my non-stress test 2 times a week. So I don't know what will I do with my schedule at work, because I'm already scheduled the whole August, and then maybe I'll just talk to my manager regarding my schedule with the non-stress test, because until now they haven't given me my schedule for that, but it's gonna be 2 times a week. So we'll see, and I'll also give an update to you. So do you guys started, or are you going to start your non-stress test too? Please let me know. And as for baby products, I really haven't bought anything yet. But we will start buying things probably next month on my 8th month. So I want to know if you guys bought anything already or your list is already complete. And also, I haven't packed my hospital bag yet, but I will do soon. So guys, that's it for this week's pregnancy update. If you guys have any questions, comments, or any suggestions or any feedbacks, I will greatly appreciate it. Just put it on the comment box below. I'll do my best to get back to you as soon as I can. And I'll see you next week for my week 32 pregnancy update. If you guys like my video, please give it a thumbs up and subscribe for more updates and videos. Thank you!